welcome to Mental Health Matters. I'm your host, Courtney Gedeon, and today we are talking about first responders and mental health. The COVID-19 pandemic has had a profound effect on our mental health. There have been increased reports of stress, depression, addiction, anxiety, and loss. This is particularly true for our heroic frontline workers who risk their health and well-being while continuing to provide essential care for all of us. With that, it is my honor and pleasure to introduce my first guest, lead community paramedic, Karen McIntyre. Karen, welcome to the show.
Hi, thank you so much for having me. I appreciate it.
Well, before we start, Karen, I just want to say thank you for everything that you do. I know that it's not an easy job, and so many of us depend on you getting up, going to work every day. And so I just want to say thank you so much for the service that you provide to our community.
Oh, thank you so much. We really appreciate that. Thank you.
So I guess my first question is, I'm just interested to learn a little bit about how long you've been a paramedic and why you chose to go into this profession.
Yeah, absolutely. So I've been a paramedic for 6 years, so I'm still fairly early on in my career. And what made me want to go into this profession was ever since I was a child, really, I was always interested in science and in healthcare and in helping people. So when I was young, my mom used to call me her little paramedic because I would always be the first person to run to the medicine cabinet and grab bandages and medicines whenever someone was sick or injured. So I just always wanted to help people. And that interest only grew as I got older. So I knew I wanted to go into healthcare and toyed with a few different options and kind of found myself back into paramedic school. And I love the program and I really enjoy what I do now. I get to say I help people every day, and that's pretty fantastic. So.
Yeah, absolutely. Well, as you said, it sounds like you were meant for this role. And so just to fill our viewers in a little bit, can you explain what kind of calls a paramedic would go to?
Yeah, absolutely. Honestly, everything and anything. I think when
Okay.
people call 911, they're calling for help. And we have various different avenues, whether it's police or fire or paramedics that will come. So the majority of things that paramedics will get sent to is if there's kind of a medical complaint or something trauma related. Those are kind of our two main categories. So a medical type call could be anything from an anxiety attack to someone faints, someone's had a seizure, they have chest pain or having a heart attack, to something more serious like a cardiac arrest. And some of the trauma type calls that we might go to would be either like minor or major car accidents. So we do some major traumas for sure. And then anything kind of even simple like a sprain or an ankle fracture.
Okay. So, but then you are also a lead community paramedic. So is that different than, I guess, a regular paramedic?
Yeah, so I'm not currently working on the ambulance. We do some shifts here and there to keep kind of our skills up. But I work kind of blended out of an office and out on the road, and we do kind of non-emergent episodic type home care. So we can go in and do kind of non-critical home visits and do things like point of care testing, physical assessments. We've also been really instrumental during the pandemic in doing COVID testing and vaccinations, especially for some of our kind of vulnerable homebound clients who have trouble getting out to a clinic. We do referrals from 911. We have paramedics that kind of refer directly to us, and then we do system navigation for individuals to kind of help them get some services and supports at home that they need. So lots of different areas that we go into.
Yeah, you guys really cover so much. Well, you've been a paramedic, you said, I think, for about 6 years.
Mm-hmm.
And what is something that you can say that you didn't expect that came with the job? Is there anything that has surprised you about the work?
Well, that surprises me. That's hard to say. I think every day really you can end up with surprises, right? Like every day is just so different. You never know what you're going to get. I think one thing that's been surprising is just kind of the opportunities we've been able to get into with things like community paramedicine and really helping out during the pandemic and helping out with agencies kind of like public health and just helping out our community in other ways. I think it's also sometimes surprises me just how much ongoing learning you do. Like I learn something new every day, which is really fantastic. I love learning. So you do kind of find a learning opportunity in every day when you interact with people.
Right. Now, like you said, every day is different. So I think that would create maybe some excitement with it, but maybe some particular challenges as well. Are there any specific challenges that you have found with the role?
Yeah, absolutely. I think sometimes with the unknown comes a lot of, discomfort, and sometimes we really don't know what situations we're walking into, or where things are going to lead. And sometimes you don't know what things are going to affect you. So I think some of kind of the really big trauma calls are things that seem obvious that might affect someone, but sometimes you never know if something kind of reminds you of a family member or a past experience.
Okay.
And sometimes you take that stuff home with you as well, and it can affect you. So yeah.
Yeah. And so, talking about things that affect you, I mean, this pandemic has been very stressful on everybody. How has the pandemic made it harder to be a paramedic?
Uh, Many different ways. I think one thing really is with the pandemic, kind of our 911 call volume has really gone up. So we've just been busier, and with more calls and busier paramedics, you get a lot more stress and a lot more burnout, a lot of fatigue. We're also seeing that, part of the problem with the pandemic is that we have a lack of all those outlets that we used to have to kind of release some of that stress. So not being able to have social time with friends and family, not being able to go to the gym or play sports, that sort of stuff. So a lot of the outlets that we used to have to kind of help with our wellness have really kind of gone away during the restrictions.
And what's the culture like in terms of talking about mental health when you're a paramedic? Do you find that it's a supportive environment, or do you kind of have to have that thick, tough skin, persona about you?
I would say it's very supportive nowadays. I think in the past, in paramedicine and probably other, emergency first response services and healthcare services, there used to be a lot more of that culture where, we're the heroes, we help people, we fix things, and it's hard to be vulnerable and say that you're the one that needs some help. But I would say that our culture has become much more supportive nowadays, and we really do have a lot of kind of outlets and opportunities to get some help if we need it, and to reach out to people and get that support.
So would you say there's been a reduced stigma around talking about mental health?
Yeah, absolutely. I believe so. I think, we've been very fortunate. There's a lot of kind of campaigns out there like, Bell Let's Talk and Heroes
Yes.
Are Human, that have really kind of helped to reduce some of that stigma and make
Well,
people feel more comfortable coming forward.
well, and I think that's so important, because the more we can talk about these things, the better we can all be around mental health. And so thank you so much, Karen. We will be bringing you back. Don't go away. More Mental Health Matters when we return.
Thank you.
Hello, and welcome back to Mental Health Matters. I'm your host, Courtney Gedeon, and today we are talking about frontline workers and mental health. It is my pleasure to bring back registered psychotherapist specializing in trauma, Joddie Walker. Joddie, thank you so much for joining us today.
Oh, thank you for having me, Courtney. I always love being here and talking about mental health topics.
Well, I couldn't think of anybody better specifically for our topic today. But what I would really love, Joddie, is for those at home to learn a little bit about who Joddie Walker is. So can you explain to us a little bit about what you do and your area of expertise?
Sure. So I'm a registered psychotherapist, and the clients that I serve are primarily first responders. So that includes fire, paramedic, police, corrections, healthcare. Like, there's a variety of first responders that I see. I do also see some adolescents and what we call civilians. And so I do one-on-one treatment for people with PTSD, anxiety, and/or depression. I also do groups for first responders, group treatment, as well as I do lots of different training, which includes training specifically to first responder populations on development of peer support programs.
Wow. Oh my goodness. There's a lot of hats and things that you're doing there. You're very busy. So with that, this past couple of years has been so hard on all of the first responders. What are some of the common mental health diagnoses that you're seeing?
Yeah, the sad and hard thing is, these are first responders who are not only responding to the pandemic, supporting people, caring for people who are experiencing health crises, but they themselves are individuals who are living in the pandemic, right? So they're not immune to what we commonly see in the general population. We see anxiety, depression, post-traumatic stress disorder. We see an increase in substance use as people are just trying to numb out or cope with the distress and loneliness. As we heard from Karen, how those healthy coping strategies have been taken away due to lockdowns. It's very common for people to turn to unhealthy coping strategies, and first responders are no different than the rest of us.
And so did you see, because you were dealing with first responders before the pandemic, were you not?
Yeah, I've been treating first responders for about 8 or 9 years now.
Oh, wow. Okay. So were there any major shifts or any, big changes that you saw between pre-pandemic versus right in the middle of the pandemic?
Yeah, I mean, as Karen touched on, the burnout, right? So what the population doesn't see is that, yes, those 911 calls have escalated, but that means that their ability to take breaks, have uninterrupted lunches, get off shift when they're supposed to be off shift to return to their family, have all been compromised, as well as that elevated fear of bringing home the virus to their family at the peak of the pandemic. That was another element of stress and traumatic stress that our first responders had to cope with.
Right. Now you used the word burnout. Can you explain a little bit what burnout would be, and also maybe some signs that somebody could recognize to say, oh, maybe this could be the beginning of burnout?
Yeah, so burnout, really at the heart of it, is an imbalance, right? An imbalance between what we give in the workplace, both emotionally, physically, and that being counterbalanced with the good stuff, the why we come to the job in the first place, or what we call our compassion satisfaction with the work, and being counterbalanced with all the positive things in life. So that's not just all trauma, really difficult things that we see in the course of our work as first responder. So in the last 2 years, there has been absolutely no balance. So what that looks like is really apathy, detachment, negativity, right? As that burnout really creeps in.
Interesting. Okay. I guess that would really not be those would not be beneficial feelings when you're trying to help others.
Yeah. And really, again, it robs you of the reason why you were drawn to this occupation and work in the first place, right? So if you feel so horrible when you start your day and then have to kind of feel like you're dragging yourself through your day, and then
Yeah.
you come home and you still feel low and no energy, that's really difficult.
Absolutely. Now, you have mentioned before that you referenced it as an occupational stress injury versus a mental health disorder. Can you explain that a little bit to us?
Sure. So, in the occupations such as psychiatry, when they diagnose, they pull their diagnoses from the DSM-5, and that's your clinical labels around post-traumatic stress disorder, depression, anxiety, versus an occupational stress injury. The language of that is so powerful because it really strongly connects that what I'm experiencing as a first responder, the trauma symptoms that I am experiencing, it's because of the work that I'm doing. It's an occupational stress injury.
I see.
And that
Okay.
is geared towards helping people understand and remove the shame that a lot of first responders experience when they start to have the onset of these various symptoms.
Now, I can't even believe, with shame, because I've read before that first responders will come to therapy with feelings of shame. And this shocks me because, in my eyes, they're heroes. They have nothing to be shameful for. In fact, it's quite the opposite. They need to be applauded for running in when everybody else is running out. So
Yeah.
can you explain this shame and how does this happen?
So we have to understand the mindset of a first responder and the personality who those individuals who come to those occupations, right? They are people who are go-getters, get the job done, have the ability to ignore their physical and emotional distress in the moments in order to serve others. Um, and then you layer that with the culture. So when people start to struggle, it starts to question their own identity. Like, what's wrong with me? I'm broken. I can't do what I used to do. People are going to think I can't do the job anymore. So there's lots of elements of shame as people then look in the mirror and say, what's wrong with me? Like, who am I anymore? Um, and that title of hero, first responders tend to shy away from that too, right? The recognition that yes, they're doing extraordinary duties in the course of their work that most of the population could never do, but they don't want to be seen as heroes. More than anything, they want to be seen as real people with real feelings and real symptoms, and get that support that everyone else gets and deserves too.
I guess I can see that because when you put that hero title on them, it almost makes them, it's almost an unrealistic expectation,
Mhm.
right? So I guess that's how I could see that would affect somebody.
Yeah, absolutely.
So in terms of treatment, Joddie, what are ways that you would go about helping a first responder?
So treatment can look different for different people. We have outpatient treatment, would be the example of coming to see me on a weekly basis, or we have inpatient treatment. So, for example, Bellwood, Homewood would be a couple examples of going into treatment for they have specialized first responder programs. So for outpatient treatment, it looks like evidence-based modalities that we know through research help people with anxiety, PTSD, depression. So for PTSD, we're looking at exposure type treatments such as cognitive processing, and a whole host of other adjunct therapies that can help people.
Wow. Well, I just love all the work that you do, Joddie. You are so important in our community, being there for the first responders so that they can be there for us. So, and you're always a wealth of wonderful information. So thank you. We will be right back. There's more Mental Health Matters when we return. Hello and welcome back to Mental Health Matters. I'm your host, Courtney Gedeon, and today we are talking about frontline workers and mental health. It is my pleasure to be joined by both of my guests, lead community paramedic Karen McIntyre and registered psychotherapist specializing in trauma, Joddie Walker. Thank you both, ladies, for joining me today on this very important episode. Now, I wanted to jump in because Karen, Joddie and I were talking a little bit about burnout. Is that something that you felt during the pandemic? And are you perhaps a little more aware of the warning signs of burnout now?
Yeah, absolutely. I think it's very common for paramedics to feel burnout throughout their career in this job, and in particular during the pandemic. I certainly could say myself that I have felt burnout at certain times, absolutely, both when I was on the road working during the pandemic and in my role as a community paramedic. I think, for me, being aware of some of the warning signs is just noticing any changes in myself. I really try to be very self-aware, and kind of check in with myself regularly and reflect to see, am I sleeping well? Am I eating well? Do I have any changes kind of physically? And then also emotionally, like, am I more hyperreactive or hypersensitive than I usually am? Am I still getting satisfaction out of my job when I come to work every day? Those sort of things I kind of check in with myself to make sure that my mental well-being is kind of still hanging in there. And if it's not, then I know that that's when I need to reach out.
Joddie, any thoughts about hearing Karen's story? Does it resonate? Has it been consistent with what you're hearing from other frontline workers?
Absolutely. And Karen, it's just so exciting to hear you so attuned to yourself and the symptoms that you have to watch out for. And I applaud you for, your strength and courage in doing things like this show, because by you talking about it reduces the stigma that, only certain kinds of people have mental health struggles. No, it happens at anyone at any time. So thank you, Karen, for being on the show. It will make a huge difference to first responders.
Oh, thank you. I appreciate that.
Yeah, it's true. Once we talk about our mental health, it gives permission for others to talk about it too. And that's partly why I wanted to do this show, was to make it okay not to be okay. We've all heard that saying. So Karen, I guess if another frontline worker is watching this episode and they're not doing so well with their mental health, would you have any words of wisdom or encouragement for them?
Yeah, absolutely. I think, I would say same type of thing that I do for myself, or I try to do, is make sure you're checking in with yourself. And if you identify that there's something that's not right or something that's different, absolutely reach out. I think, like we said, the stigma has been reduced and is still being reduced at this time. And there's a lot of opportunities and a lot of avenues for you to reach out for support. And I would strongly encourage them to do so. We have everything from kind of peer supporters to professionals that can help. So there's a lot of opportunity to reach out, and I would, urge them to be courageous and do so.
Now, Joddie, how important is group counseling when it comes to first responders? Is that something they're embarrassed to do, or is that helpful?
Oh, great question. It can be twofold. One, it can be so helpful because once people are in group and they actually get to experience not being alone versus someone telling them you're not alone. They hear from their peers in the group the similar symptoms and struggles, and all of a sudden it normalizes so much for them. But at the same time, it's so hard to get first responders to go to group because of the stigma and embarrassment and shame. So there are amazing organizations out there that do that peer support model, such as Badge of Life, Wings of Change. If I've forgotten any, it's only because they've just escaped me in the moment, not because I'm not endorsing so many wonderful programs. And as Karen mentioned, peer support programs within each organization itself can be really helpful to get the injured first responder from that recognition that they're suffering and the peer becomes the bridge to mental health. Because sometimes it's so hard to pick up the phone to a mental health therapist to say, I need help. So sometimes starting with a peer who can help them with that can be a first step.
I think there would be a lot of value too in talking with somebody who gets it, who's experienced the same issues that you've experienced, who's lived that same experience in a sense. Now, Joddie, if a first responder or anybody is really wanting to reach out to you for some help, how can they get in touch?
Absolutely. So my email would be jwalkertrauma@gmail.com. My website, which has a contact page, jwalkertrauma.com, or my cell, 289-383-0355. Lots of ways to get in touch with me.
Yes. And again, it sounds like you're doing so many amazing things within the community. So thank you for being there. I know that a lot of therapists have been working overtime as well during this pandemic. And so thank you, Joddie, for your service. And Karen, again, it's so amazing what you're doing in the community. I've been educated today about the word hero, so thank you, Joddie, for saying that to me too. And again, both to you, thank you for being on the show today. It's really important. And thank you at home for watching. I'm your host, Courtney Gedeon. This is Mental Health Matters.